Hello, students, and welcome to my lecture on medicine and healthcare. Okay, um, today I'm going to talk about the Affordable Care Act, and I'm sure you've all heard of it, and it's quite confusing, so I'm going to break it down as best I can. One of the reasons why it's so confusing is because it's a hodgepodge of all sorts of different constituencies. So there's been there's a lot of um, you know, aspects to the law, and also the way you hear people talk about it, particularly politicians and the media. It's not always clear what they're talking about and how the arguments are framed. Is Can be kind of a problem. So let's get into it. Um, let's see. Let's get into the act. Let's get into the act here. So slideshow from current slide. I hope this works. My PowerPoint's kind of sticky here, so here this goes. Okay, so um, healthcare reform has been a major concern for a long time. We spend more money on healthcare than any other country in the world, both in terms of dollar amount and gross domestic product. It's about gross domestic product, it's been about 16%, give or take a percentage point for a long time. Yet we are not the healthiest. And we also we don't guarantee health care for every member of society, unlike every other industrial society in the world. Okay. And some of the developing countries guarantee, or the semi-periphery countries, they guarantee health care, but we don't. Okay, in the United States. So there are a lot of ideas being passed around. So one notable thing that happened is in 2006, Massachusetts passed a healthcare reform law, so that we informally call Romney Care because that's is named after Governor Mitt Romney. And it served as a model for the Patient Protection and Affordable Care Act, otherwise known as the Affordable Care Act, otherwise known as Obamacare. Okay, so at a glance, this is what Obamacare does. First of all, insurance companies can no longer deny coverage for those with the pre-existing conditions. Okay, in the old days, if you had pre-existing condition, some kind of health problem, insurance companies could deny coverage and you cannot get health insurance. The Affordable Care Act has forbidden this practice. Insurance companies have to pay 80 to 85% of healthcare premium dollars on patient care, okay, instead of overhead or profit. This was in order to control administrative costs. In the old system before Obamacare, administrative costs, well, depending upon the healthcare company, but administrative costs was about 31% of healthcare spending, especially all of these utilization reviews, they're called, like when you go to a doctor and the doctor says you need one thing, let's say an MRI, their insurance company might not cover it. And there's something called utilization reviews that, people look at and see, like, if you really need that in their opinion and if they'll pay for it. That you got to hire people to do that. That's part of the administrative cost. So to run the healthcare system was about 31% of healthcare spending. So if they don't pay 80 to 85% of healthcare premium dollars on patient care, they have to offer some refunds. Okay, insurance companies must provide some preventive health coverage without deductible or copayment, including, except for some religious exemptions, birth control. They cannot drop you if you get sick. They cannot have annual limits or lifetime dollar limits. One big problem before the Affordable Care Act was something called medical bankruptcies. About 50% of all bankruptcies were due in part to medical bills. Most of the people who would declare medical bankruptcies would have insurance, but the insurance wouldn't cover enough. So if you hit your annual or lifetime dollar limit, they would start just billing you, and people couldn't pay out of pocket. So people with cancer particularly had high medical bills. So this practice has ended. Okay. What else? The individual mandate. This is important. This is called the individual mandate. Individuals must have health insurance. If an individual does not have health insurance, they pay an extra tax to the IRS. This was part of Obamacare as well. The Supreme Court upheld a challenge to the individual mandate, too. They said that it was because you paid for it through your taxes, that there would be an extra tax if you didn't have health insurance. However, in recent tax reform legislation, it was repealed. So we'll get to the consequences of that repeal later. So pretty soon, like I guess next year, there'll either it's not going to be there or it's just not going to be enforced. So creates health insurance exchanges, okay, in which individuals buy insurance on the open market, okay, a way for people to do it. So let's see. So most of us get health insurance through work. But for those of us who are, say, self-employed or unemployed, or our work doesn't provide health insurance, we could go to something called the exchanges, such as one exchange is called Covered California. You may have seen some of the advertisements for it, where if you go to Covered California, you put in some information and you come up with different healthcare plans. Pops up some healthcare plans. I think it's platinum, gold, silver, and bronze. They have different kinds of coverages, and each category is supposed to cover certain things. A lot of it has to do with how much deductible and how much premium and things like that. Also, what you might be able to get in terms of a subsidy. Okay. The expansion of Medicaid. Okay, Medicaid is the federal medical scheme for people who are poor, okay, or people who basically don't make enough money to buy health insurance. So this was to provide assistance to those who make under 138% of poverty level, okay, but in this challenge to Obamacare, the Supreme Court struck down this part of the Affordable Care Act that mandates that states expand Medicaid. Okay, even though it wouldn't cost them anything, about half the states at the time decided not to expand Medicaid. You might discuss about why you think that is. Why would these states refuse federal money that would provide health insurance for their poor? You might think about that. Okay. The employers of more than 50 full-time equivalent employees must provide health care or pay a penalty. Okay. So many employers, when this went into effect, started cutting back their workers' hours so they wouldn't have to pay the penalty. Okay. So that's the Affordable Care Act in a nutshell. There are many different nuances about it, so let's get into a little bit of history. Jill Quadagno is one of my favorite sociologists when it comes to analyzing social policies, and she wrote an article called, first let me get to the consequences of the repeal of the individual mandate. Okay, so according to the Kaiser Family Foundation, the individual mandate reduced the number of uninsured from 43 million in 2013 to 27.6 million in 2016. So about, do the math, 15.5 million people got health insurance. Okay. Adjust for population a little bit. Yeah, but that's an improvement, okay, but still not universal coverage. According to the Congressional Budget Office, repealing the mandate will result in 4 million more uninsured by 2019, so this year, 13 more million uninsured by 2027, and a 10% increase in premiums in the non-group insurance market. Okay, so this is quite a consequence here. So one thing to understand is that the individual mandate works with the employee, with insurance companies not being able to reject you because of a pre-existing condition. So insurance companies have to take you. So what the insurance companies say is that if we have to insure everybody, then everybody must have health insurance, because otherwise the tendency is that the young and the healthy don't get health insurance because they figure they're going to be fine. And so the insurance companies are only insuring the older and the people more prone to get sick. So what they're saying, so we need to spread the risk. We need to be able to get the younger people, the healthier people insured as well. That's so in order for us to cover everybody. Does that make sense? I hope so. Okay. So Joe Cardagno, right-wing conspiracy, socialist plot, the origins of the Patient Protection and Affordable Care Act. Okay, so the Affordable Care Act was not brand new, but was based upon years of policy proposals. Okay. First of all, let's start with mandates. And the employer mandate was in Richard Nixon's 1974 comprehensive health insurance plan. And it was, So I'm having a little trouble with the lights if I'm recording this. Okay, so I will be back shortly. Hang on. Okay, I am back. So, Nixon's comprehensive health care insurance plan, it was in a plan that Jimmy Carter had too in the 1970s. The problem some economists feared was something called job lock, or the inability for workers to leave jobs because of losing benefits. You may have heard about this thing before, where somebody might want to quit their job, but then they'd have to give up their health insurance. Okay, that was a concern there. So to address job lock, some started proposing the individual mandate. A guy named Stuart Butler from the Heritage Foundation was really the first one to write about it. Okay. He said, quote, "This mandate is based on two important principles. First, that health care protection is the responsibility of individuals, not employers. Second, it assumes that there is an implicit contract between households and society based on the notion that health insurance is not like other forms of insurance protection. If a young man wrecks his Porsche and has not had the foresight to obtain insurance, we may commiserate, but society feels no obligation to repair his car. But health insurance is different. If a man is struck down by a heart attack in the street, Americans will care for him whether or not he has health insurance. Each household has the obligation, to the extent it is able, to avoid placing demands on society by protecting itself." This mandate then was included in George Bush's, the first George Bush Comprehensive Health Reform Act of 1992. So yes, it was a Republican idea. Then we go to the Clinton years. Okay, it was a Republican idea. That's what I want to emphasize. This is a big old thing. So, health, American Health Security Act of 1993. This, one of the cornerstones here was health alliances that would bargain with health insurance companies, as were standardized healthcare plans and insurance company regulations. Part of this also would have set the price of premiums. Republicans fought this through a series of commercials called Harry and Louise. You might want to watch some of these things. They're pretty interesting. So Republicans, like a congressperson named Chafee, had turned to their own proposal called Health Equity and Access Reform Today. This is very important, okay? It had mandates. It had the regulations of the insurance industry. It had standard benefit packages, but it didn't have enough Republican support, so it didn't go anywhere, okay? So there were other things that influenced health policy in the 90s, like we had a HIPAA. Usually that has to do with health care privacy, but there were some, it also had limits on pre-existing conditions, exclusions, and things like that. And something called SCHIP, which was for children. Expand Medicaid to cover children below 200% of the poverty level. Okay. Then we go into the Massachusetts Healthcare Reform Plan of 1996. This has state insurance coverage, the employer mandate, the individual mandate. Mitt Romney, Republican governor, said, no longer can individuals free ride by seeking health care and expecting society to bear the cost. Okay. Had subsidies for adults under 150% of the poverty level and children under 300% of the poverty level. It had 98% coverage by 2010. Okay. The Healthy Americans Act later on didn't pass, but also had the individual mandate. It also sought to eliminate the tax benefit employers get by providing health care, and that was controversial. Then we get the Patient Protection and Affordable Care Act in 2010, but it was very, okay, let's go back to this. Let's see if I can go back. Remember this slide here, and remember HART had all of those things. So then we get the Patient Protection and Affordable Care Act. Here is something that when you compare them, the HART bill with the ACA, okay? They had the individual mandate. They had fines on employers. They had standard benefits packages. They had bans on denying medical coverage for pre-existing conditions. They established state-based exchange purchasing groups. They offered subsidies for low-income people to buy insurance. Improves efficiency of the healthcare system. Reduces growth in Medicare spending. Controls high healthcare costs. Prohibits insurance from canceling coverage. The ACA prohibited insurance from setting lifetime spending caps, and the HART bill did not. The ACA expanded Medicaid, the HART bill did not, and the ACA extends coverage to dependents, but the HART bill did not. Yes, this was mostly a Republican idea, okay? Mostly a Republican idea that started from the Heritage Foundation with Stuart Butler. That's especially the mandates. Okay, the mandates, the individual mandate. Now, if you listen to the debate about healthcare right now, what you get on the Republican side is that they're against the mandates. They like the idea that They like the idea that insurance companies cannot deny you because of a pre-existing condition, but they have fought hard on it on the mandates when the mandates were originally a Republican idea. So Obama basically got all these ideas together and tried to like compromise with everybody. And so it's including some Republican ideas. So with we still have a problem, okay? In 2017, 27 million Americans uninsured, and it's getting worse. Healthcare expenditures in 2017, $3 trillion. That is $10,739 per person. It is 17.9% of GDP, more than any other country in the world, okay? So, what about Medicare for all or a single payer plan? Similar to what they have in Canada or similar to what they have in many places around the world, but everybody gets health insurance here. There is a plan out there, or there was a plan out there. It was introduced in the last Congress, that ended in 2018. It was Senate Bill 1806. And I'm going to go through this bill because this bill was analyzed, and I'll give you the analysis too. Right now, there's another bill that I'll talk about briefly. So 115th Congress introduced Senate Bill 1804, the Medicare for All Act. This would enroll everyone in Medicare. So if you are unfamiliar with Medicare, Medicare is the health care scheme for old people 65 and older. So they have basic, a lot of their needs covered. It doesn't cover everything. Many people buy supplemental insurance, but everybody has health insurance that's 65 and older. Okay, let's see. It enrolls everyone in Medicare, and it covered all sorts of things. Okay, these all sorts of things includes inpatient and outpatient hospital services, ambulatory services, primary care and preventive services, chronic disease management, prescription drugs and medical devices, mental health and substance abuse treatment, laboratory and diagnostic services, pediatrics, reproductive, maternity and newborn services, oral, hearing, and vision services, and short-term rehabilitative and habilitative services. So I've heard that the most recent bill now even covers long-term illness and things like that. So if you are have a long-term illness or something, you can be covered there as well, where this bill did not. So an analysis of this was done by the University of Massachusetts Political Economy Research Institute, okay, about how it would be paid for and what would be the consequence. Business premiums. Right now, employers pay into healthcare insurance. You continue that with a cut of 8 to 13%. So there'll still be business premiums, but they'd pay less. Okay. 3.75% sales tax on non-necessities. A net worth tax of 0.38% exempt on the first $1 million. So if you earn your first $1 million of net worth, remember net worth is what you own minus what you owe. Those people who are millionaires would pay a tax of 0.38% exempt on the first $1 million. So that's not a lot of money. I think it's like $3,800. But when you look at compared to what millions and so. And then taxing long-term capital gains as ordinary income. Capital gains is something that is basically what you get from investments. So let's say you buy a house for $500,000 and you sell it for $1 million. That $500,000 is capital gains. That is taxed at a lower rate than regular income tax, ordinary income tax that we all pay through our jobs. Okay, and so UMass Political Economy Research Institute said, what if we tax that at the same rate as ordinary income? So here's how it would break down according to them. The result would be net healthcare costs for middle income families would fall 2.6% to 14%. For the top 20% of income, they would see their costs of healthcare rise by 3.7%. And for the top 5%, it would rise about 4.7%. So it would reduce overall healthcare spending by 10%, and over 10 years, that would save $5.1 trillion. So we would pay less on healthcare. Most individuals would pay less, okay? Between like 2.6% less and 14% less. Most of us would pay less. A few of us at the top would pay more. So that's how that would go. Okay, so thank you for listening. And remember, and this will, yeah. So remember, you got to know this stuff. Okay? And I will talk to you later. Bye.